to cloud server. Okay. Like no idea how to know. But yeah, so you're all right, Sarah? I think you're a co-host. Are you okay with everything?
I think so. I've just lost
right.
everyone off screen though. I can't see anyone, but that's all right.
Yeah. Okay, I'm going to go on mute, but at 12, at 1, I'll start the webinar.
All right, so it's
okay?
1 o'clock now. Do we want to?
All right. Yep, we'll do.
Good afternoon, everyone, and welcome to the Australian Primary Care Nurses Association IPC webinar. We'll just give it a minute or so until everyone arrives, and then we'll get started. Alrighty, we might make a start. So good afternoon, everyone, and welcome, and thank you for giving up your lunchtime on a Wednesday afternoon. My name is Sarah Drew, and I'm one of the program managers at APNA, and I'm joined today by Lisa Sinkins, who also joins me as part of the IPC team, and Megan Riley, who's our SME for the IPC program. So just before we start today, I would like to just acknowledge the traditional owners of the country throughout Australia and their continuing connection to land, sea and community. And we pay our respects to them, their cultures, to the elders past, present and emerging. So like I said, welcome today to what is technically our first, but at the moment it's our second, for those of you that joined us last week, around continuing safe vaccination services during COVID. But for the IPC team's webinar. Now, these webinars we'll be doing on a monthly basis over the next 6 months, and we'll share those details with you as we go. So today's webinar is focusing on the principles of environmental cleaning. And as I've already said, this webinar is part of the APNA Infection Prevention Helpline in association with Murray PHN. Today we are joined by Megan, who will be taking us through the presentation. But just before we start, it would be remiss of me if I didn't give a little bit of a plug for our service. So you'll see on screen here that the Infection Prevention Helpline is a new service that has been set up recently, and it's designed for any staff member, both clinical and non-clinical, that's working in general practice, community pharmacy, or an Aboriginal controlled community health organisation. We encourage you to contact us about anything relating to infection prevention and control. We say this, that it's not just in regards to COVID, although we are all snowed by it at the moment, and it is a huge focus with what we're dealing with on a daily basis, but certainly the design of the program is for anything related to infection prevention and control. So it's a free service that's available for primary care services wishing to review or upgrade their infection control practices, or to simply ask us a question. You can do this by either phoning the numbers that you can see on your screen there, or submitting an inquiry via our web form through infectionpreventionhelpline.com.au. So to get us started on today's session, I'd like to actually introduce to you Megan Riley. Megan Riley, as I've already mentioned, is one of our subject matter experts that supports the Infection Prevention Helpline. Megan's a registered general nurse and is the director of hands-on infection control, Megan, which is based out of WA. As you can see on screen there, Megan holds a large number of qualifications and has certainly been an amazing resource to us as part of this program. What are we doing today? what's Megan going to take us through? So in essence, she's going to give us the top 10, that's a tongue tie, top 10 guides to environmental cleaning principles. And we're going to conduct a bit of a Q&A. So we've already had some questions submitted prior to this workshop. So we'll tackle those questions for you. And certainly you'll see on your screen that there is a Q&A section. Please, as we go through, if any of the presentation raises any questions for you, pop them in there. We're going to do our absolute best to get through them in the half an hour that we have today. In saying that, if we don't get through them, we will certainly respond to everyone through a Q&A document post-workshop. And you'll see also that you'll be able to upvote. So if someone poses a question, please feel free to upvote that, and we will certainly go with those top questions in the Q&A section. So really our learning outcomes for today are that we want to be able to have you leave this session with the skills to be able to apply a risk-based management approach to environmental cleaning and identify, as I've already said, the top 10 principles that can be applied in your primary healthcare practice setting. The intent is that we give you this high level today, and should you need any further support to actually implement any of the things that are presented today, that's what we're here for at the helpline. So please feel free to reach out to us. But for now, I'm going to hand over to Megan to get us started.
Thank you very much. And greetings from Noongar Budja in Western Australia. It's lovely to be able to present to you all this afternoon. I know that you've been through a pretty hard time and you're starting to come out the other side. We've been very lucky here in Western Australia. We're in phase 5, and so far, fingers crossed, things are going well for us. But we are at risk with our cargo ships offshore at the moment, unfortunately. Now, we know that the environment is a potential reservoir for microorganisms, and it's closely linked to the chain of infection. And therefore, environmental cleaning is a fundamental intervention of an effective infection prevention and control program. So it is part of standard precautions, and as you know, we apply those precautions to all patients in all healthcare settings. So we need to be able to manage or identify first what are our competing microorganisms within our relative environments, and then manage those microorganisms. And how we do that is through an effective environmental cleaning strategy. But I think it's important to state that cleaning alone it's not a standalone intervention. It's actually a multifaceted intervention, or what we often refer to as a bundle. So while we will be talking about cleaning and disinfection, we have to remember that it sits alongside other key infection prevention and control program elements, and that includes governance, education and training, safety and health, monitoring and feedback mechanisms. So just to briefly touch on environmental transmission, we certainly know that environmental transmission can occur of healthcare associated infections, and that occurs in different ways. So we have a colonised or an infected patient who may come into our practice, and they can touch environmental surfaces and also non-critical equipment, and can therefore contaminate that surface. We then find that the contaminated hands may be, excuse me, of the patient, or that of the healthcare worker, or the patient's carer or visitors come into contact then. Can we just slip back?
Sorry, we have.
Thank you. Then comes into contact with the susceptible patient. So contaminated hands or contaminated gloved hands of either healthcare workers or visitors or the carers of patients can also contaminate environmental surfaces in this way. So that's why hand hygiene is very important, but also so is our environmental cleaning, and they really do go hand in hand. We know that we don't always have good compliance with hand hygiene, so therefore our environmental cleaning strategy should be very effective. We also know that we work in a challenging environment where we have pathogens where their motto is survival of the fittest. And we know that some of them can actually survive on environmental surfaces and on the hands of healthcare workers for minutes, hours, and sometimes even months if we're talking about organisms such as Clostridium difficile, which is a spore-forming organism. The actual survival times of those pathogens will vary considerably, and there's certainly ambient, the factors within the ambient environment, such as temperature, humidity, and even surface type, will certainly vary considerably and vary the risk associated with that. We know that too, within the literature, there is certainly evidence that if you have an effective cleaning strategy, it will reduce your risk of healthcare associated infection, and that must contribute to outbreak and as well as pandemic control. So as we go through, we might refer to some of these organisms. So the first principle is that we really need to be taking a risk-based approach. The purpose of this presentation is not to be prescriptive, to tell you how, why, when, and what to do for cleaning, but to give you some principles. And the first one is, if we take a risk-based approach, that actually assists us to determine what cleaning method, what cleaning process, the frequency of our cleaning, and the products that we need to use, whether we're doing our routine cleaning or perhaps we need to do some enhanced or contingency cleaning, which I'm sure all of you have been madly doing over, well, basically since February of last year. So I like to use the PDAC model, which is a Canadian model from their environmental cleaning guidelines, where they look at a number of factors within a practice environment, and this will help you to determine those requirements for your cleaning strategy. The first one, in order to determine the level of environmental cleaning or the need, is what is the probability of environmental surfaces and patient equipment within your environment becoming contaminated with pathogens? Is it a heavy contamination, moderate, or light? The second thing we need to consider is the vulnerability of your population who comes into your practice. Are they more susceptible to infection or are they less susceptible? And then we need to look at the potential for exposure. And that really comes down to, I suppose, the types of surfaces and whether they're high touch or common touch surfaces within your environment, or whether they're low touch surfaces. So once we've been able to actually categorize those risk factors, we can then move on and actually utilizing a risk matrix, determine what our risk stratification score is, whether that's low, moderate, or high. But some of the other things that you can, sorry, can we just go back? Some of the other things that we need to consider, other than the number and the type of microorganisms present on environmental surfaces, is the number of people within the environment, the amount of activity that's being carried out in that environment, the amount of moisture, the presence of material that's actually capable of supporting microbial growth. So we all know that if we have organic matter present, that encourages microbial growth. We need to look at the rate at which organisms that are suspended in the air can actually be removed. So ventilation becomes a really important part of the environmental conditions, but also, as I alluded to, the type of surfaces and the orientation. So we know that a horizontal surface is going to actually attract more dirt, more dust, and therefore more microorganisms. So once we've then determined our risk, we then can go on and determine what our cleaning frequency will actually be using that risk matrix. Next slide, thanks. So I've combined principle 2 and 3. So this is the cleaning method and the cleaning process. So the cleaning method is about, do I clean with a detergent or do I need to clean and disinfect my environment? And how we determine the method, excuse me, I've got a frog in my throat today. How we determine that method is really looking at the surfaces. Are they minimally touched surfaces or are they frequently touched? Frequently touched surfaces obviously bring with them more risk. And if you're in your high risk setting, then that too increases the risk. So we need to ask ourselves the question, is there a suspected to be a multi-drug resistant organism present or some other infectious agent such as COVID that will require transmission-based precautions? If the answer is no, then physically or mechanically cleaning using a detergent suitable is quite suitable within the practice. If the answer is yes, we do have an organism present such as MRSA or VRE or another infectious agent, then we have to consider the healthcare setting and the context of that setting. So in a non-acute setting, which we could certainly frame office-based practice in, we need to consider the local circumstances. So what is your patient mix? What procedures are you carrying out within that setting? And what are the local conditions? So what's happening out there in terms of community transmission of infectious disease? And we can use those factors to then assess the need for cleaning with a detergent combined with or followed by a TGA approved hospital grade disinfectant. If it was the acute setting, such as a large teaching hospital, then it would be routine that we would use a detergent combined with a disinfectant or followed by a disinfectant. So when we're looking at our process, we need to consider not just our routine cleaning, but other cleaning that we might need to do. So for instance, your unscheduled blood and body fluid spills management process, your non-critical patient care equipment, because what we have to remember about patient care equipment is that it's high touch items. They're used by healthcare workers to touch patients. They're frequently touched by healthcare workers and patients, and they're often shared between patients. We then need to consider our enhanced cleaning and disinfection. So that is in times, for instance, with COVID, we're all doing enhanced cleaning and disinfection of common touch surfaces. That might require a different method, a different process to what you normally would do with your routine cleaning. There's also your scheduled cleaning. So that tends to be the high and the hard to reach cleaning areas such as windows, blinds, etc. And then of course is our terminal cleaning. So our terminal cleaning might be at the end of a list or the end of a day, or after we've seen a patient who required transmission-based precautions and we need to do a more thorough clean and disinfect. So all of these things will actually dictate your cleaning schedule. And remember that your cleaning schedule needs to include the staff who are responsible for cleaning, the surfaces that they need to clean and the locations, the method and the process, the products used, and then of course frequency. But I probably can't stress enough how important actually cleaning is, because if we don't clean, then we can't adequately disinfect a surface. Next slide, thank you. So the cleaning frequency is really important, and that should always be justified by the risk of transmission of infection within your practice. So we know that if we're doing more frequent, rigorous cleaning, and sometimes that will need a different method or process, then environmental cleaning is required in those areas of high risk. So while we're not going to be prescriptive, a bit of a guide is if it's a frequently touched surface, then that surface needs to be cleaned at least daily, certainly when it's visibly soiled, and after every known contamination by a likely pathogen. Whereas a surface that is subject to less frequent contact will need to be cleaned less frequently. So we need to also consider the risk of transmission of particular infections. And I think we've probably all been doing that through COVID and really looking towards the literature in terms of how virulent these organisms are, the strains within this organism, how transmissible the infection is, how long it can last on a surface. So we need to look at that for particular infections, and we need to assess, and we need to be able to adjust our cleaning schedule. And for many of us, we're making almost weekly adjustments to our cleaning strategies at present. So we need to consider that for a single case of infection that a patient may bring into your practice. We need to consider what's happening out there in the community in terms of community outbreaks. And of course, we're now living through a pandemic, and we have to consider that as well. The fifth principle is around product and equipment selection. So this is really important, and we need to be very mindful of what our methodology is that we're using for our cleaning strategy, and also what that process is. So when we're choosing products and equipment, we need to think about what cleaning agents, what detergent agents we require, what disinfectant agents we require. We need to think about our supplies in terms of, are we using reusable supplies or are we using disposable equipment to clean? And of course, we need to consider personal protective equipment, because this is going to assist those who are cleaning to prevent exposure to microorganisms, to exposure to cleaning chemicals, and also the spread of microorganisms from one patient area to another. So some of the things that you might need to consider in your strategy is in terms of, will we perform a two-step clean or versus a two-in-one clean? Now, we know from the literature that it's more efficacious to do a two-step clean, but is it as practical? And does it allow staff to actually be compliant with having two very separate steps? Either method or either process needs to be effective. Do we use microfiber cloths, whether they be reusable or disposable, versus cotton conventional cloths, mop heads or mop pads? Are you going to use a reusable system or a disposable system? Or maybe it will be a combination. Your routine cleaning that might be performed by your contract cleaners or your employed cleaners may well be a reusable system, but for your clinical cleaning of environmental surfaces and your patient care equipment, you may select to use a disposable system, whether that's a disposable paper towel and a detergent solution, or whether it be a wipe of some sort. That's the next decision we need to make. Do we use a solution for our cleaning, or do we use a wipe, or can we use both for particular surfaces in particular areas? And last but not least, we need to consider the product. If we've selected to go to clean and then disinfect, we need to consider the detergent products and we need to consider the detergent disinfectant products. And again, whether that will be combined or separate processes. So I've just put a table up there that is, I find, are really important questions to ask when you are actually going through the procurement process for chemicals, whether they be detergents, but specifically in this situation, disinfectants. It's one of the most common questions I get. Tell me what disinfectant to use. I can't tell you that unless I know the ins and outs of your practice and I can perform a risk assessment. And that's why that risk-based approach is so important. But some of the factors to consider when you are selecting disinfectants or reviewing the products that you've got in place at the moment is ask the question, what does it kill? Because you want to select a product that's actually going to be effective against most common healthcare associated pathogens that we see in the practice environment. We want it to protect against organisms that cause outbreaks or those that are a major issue in our practice. We want to know, will that disinfectant have a sustained activity on the surface? Will it be effective in the presence of organic matter? And most disinfectants won't be. And has this been actually trialed in real life scenarios? Because a lot of these products are done in vitro or in the laboratory, which is not a real life scenario for your practice. And how quickly will this disinfectant actually kill the pathogen? We need to think about contact times. Some of the product disinfectants that are on the market require a 10-minute contact time. That's not going to be practical for a busy practice. How long will it keep the surfaces wet? In order to kill those pathogens? Will it evaporate quickly? And is it inactivated by organic material? Also, seriously consider the compatibility of the product with the surfaces in your practice and including the patient care equipment. It needs to be compatible, and that's where the manufacturer's instructions for use come into place. And is it compatible with the other products that you're using? Much like hand hygiene products, they need to be chemically compatible. Your cleanser, your alcohol-based hand rub, and your hand emollient all need to be chemically compatible. And the same is the requirement for disinfectants. Think about the safety issues as well. You know, what is the toxicity rating? Has this been approved? Has your detergent and your disinfectant been approved by the TGA? And what personal protective equipment will be required to be worn when using these products? Think about the ease of use. If it's a difficult product to use, then it's not going to be effective. Think about the form that the product comes in. Does it come in a spray or a wipe or a liquid? Think about what the jurisdictional requirements are for you. I know in some states in Australia, like the Northern Territory, we can't dispense chemicals in a spray format. Because of the issue of respiratory irritation and eye irritation, but also the fact that the spray mechanism actually becomes a reservoir for microorganisms because you've got a narrow lumen that you can't clean. Beautiful environment for bugs. Think about, are the instructions clear for the use of this product? What education and training will be required for the staff who clean? And last but not least is value for money. We need cost-effective options, but we need effective against microorganisms as well. And you want to be able to standardize your products wherever possible. The sixth principle is about material compatibility. And I've already really alluded to this. You really need to think about the types of fittings and the finishings and the furnishings within your practice environment. And that includes the surfaces of patient care equipment. Can they be cleaned? And are they compatible with the detergent and disinfectant products that are in use? It's one of the first questions that I ask. Provide me with the manufacturer's instructions for use, because we need to be really clear particularly when we're building new practices or perhaps we're renovating practices, if I put this surface in, can it actually be cleaned with the products that we're using? So again, I know, sorry, it's a little bit hazy on the slide, but I've just put in some things to be asking when you're actually looking at procuring products. It is important that you have a good decision-making process around this and a policy that will actually guide you to selecting and procurement. It's part of our product evaluation. Ensure that the material is actually cleanable, that it's easy to maintain and to repair, that it's actually resistant to microbial growth. So we know that porous, surfaces, so surfaces that hold moisture, are actually nice reservoirs for a lot of microorganisms. So we want that surface to be non-porous. And is it seamless? The more seams you have, the harder it is to actually clean, and the increased reservoir you have for microorganisms. I've bunched 7, 8, and 9 principles together because these are really about our administrative controls when we're looking at a risk management process. So work health and safety is critical to the cleaning strategy. And the usual things of personal hygiene, hand hygiene, including maintaining skin integrity and respiratory hygiene, are important. How the selection and use of personal protective equipment, how we handle the waste and disposal, and what immunisations should staff who or contractors have who are cleaning. Education and training underpins all of this. So anyone who cleans, whether it's a clinical or a non-clinical person, really needs to be trained on the transmission of microorganisms, because if we understand that foundation, then it makes sense when we say, this is our cleaning method and this is our cleaning process. We have to train staff around what those methods are and what those processes are, so they clearly understand how do we use the equipment, how do we handle chemicals, and how do we select and use personal protective equipment when we're cleaning. And all of this, again, is guided by documented policies and procedures. So your practice needs a specific environmental cleaning policy that is appropriate for your environment based on your risk analysis that you've undertaken. We need to then support that with developing and maintaining standard operating procedures for all of the cleaning tasks that are carried out within your practice. And last but not least, we need to be able to monitor the effectiveness of our cleaning. And if we monitor and audit, we can then have some feedback to staff who clean to let them know that they're doing a good job, or perhaps we've got an area for improvement. So it's really important that we're ensuring that we're monitoring cleaning practices to ensure that best practice is being performed. So we're not only looking at compliance with cleaning work practices, but we're looking at the level of hygiene. Is this surface, is this piece of equipment visibly clean, or is it visibly dirty? And there are a number of ways that you can actually monitor and audit. And I've just put 5 examples up there. Now, they all have disadvantages and advantages, and some are more practical than others. But performance observation, I think, is one that we certainly can do. And what we're really doing is how effective are the clinical and the cleaning staff, whether they be contractors or employed cleaning staff, adhering or complying to the standard operating procedures that have been put in place. We can also do direct observation. So this is visual assessment of the level of cleanliness. So we look at it and we go, is it visibly clean? Is it visibly soiled? Now, that can be a little subjective, because maybe how I might look at whether a surface is visibly clean may well be different to someone who's working within that practice every day and seeing the environment. But what it does is it checks the cleanliness of items. Fluorescent markers are increasingly being used in healthcare now. You're probably familiar with this type of assessment with hand hygiene. So we use things like the Glitterbug kit, where we're actually able to put fluorescent gel onto our hands and then look at it under a UV light after we've cleaned our hands to see how effective our technique is. We can do the same thing with environmental cleaning, where we actually put tracing agent marks on predetermined items and surfaces before cleaning, and then after cleaning, we come through and we can have a look at it with the UV light. It's actually a really positive way of feeding back to staff on the effectiveness of their cleaning. ATP bioluminescence, which some of you might be familiar with. This has been used for a long time in the food industry. What we're actually looking at here is the presence of organic material or protein. So that determines whether a surface has been cleaned or not. If there's still organic material showing on the surface, then we need to improve our cleaning strategy. And the last way that we can actually monitor the effectiveness of cleaning is through environmental cultures. So this is probably the only real way of actually determining, have we removed the organism, have we killed or inactivated the organism? It's not practical, it's very expensive, but it is a good way of actually assessing, particularly when we have problems where we might have ongoing transmission, excuse me, or outbreaks of infection. Just let me get a drink of water, losing my voice. So as I said, there's a range of ways that we can monitor. They do have advantages and disadvantages, and probably is a topic for another day. But I think doing those performance observations and the direct observation is actually a really good way of evaluating whether your program is effective or not. So just in summary, environmental contamination in healthcare settings does play a role in the transmission of healthcare-associated infection. It is a fundamental intervention of an effective infection prevention and control program, but it's not a standalone intervention. And as I said earlier, we need to incorporate it into a bundle where we're not only looking at method and process, but we're looking at how we support the program. And that's in addition to all of the other good practices that we do, such as hand hygiene, respiratory hygiene, etc.
Fantastic. Thank you so much for that, Megan. Certainly a lot of information there to take in and to certainly apply. I am very aware that we are at time, so I might just throw to Lisa and see if there's maybe one or two, I'm not going to say quick questions because that won't exist in this space, but maybe one or two quick questions that we can just respond to, and then we'll pop the rest into the Q&A and share with everyone after. So I'll hand to you, Lisa.
Thank you, Megan. That was great. One of the questions is, how viable is COVID in the environment?
Very good question. Now, we know that SARS-CoV-2 and or RNA actually can be found on surfaces for periods ranging from hours to days, but it does depend on the ambient environment, and that includes temperature and humidity, but also the type of surface. And we tend to see it when it remains viable when it's in particularly high concentrations, and that tends to be in healthcare facilities where we're actually treating COVID-19 patients.
Wonderful, thank you. And another question is, what is terminal cleaning?
Terminal cleaning? Yeah, it's interesting. We throw these terms around, don't we? And sometimes we're not quite sure what they are. But terminal cleaning really refers to complete and enhanced cleaning. And so that's about decontaminating an area, maybe following a treatment of a patient with a known infectious or communicable disease. So you have them on transmission-based precautions. Or it might be, for instance, in a respiratory clinic where you're seeing patients who are coming in for COVID testing with respiratory symptoms. You may, at the end of that testing list, in the morning or the afternoon or both, where you'll actually go through and you'll do a thorough, rigorous clean, but it's a clean and disinfect.
Wonderful, thank you. So what we'll do is we'll add those questions and answers with a follow-up email and along with a copy of the slides.
Excellent. Thank you, Lisa and Megan. So just before we close today, just another plug for the Victorian Infection Prevention Control Advisory Service. If anything you've heard today you would like some assistance in implementing, please do not hesitate to contact us. Other than that, we would just like to say thank you for joining us today. Our next webinar is scheduled for the last Wednesday of August. And some information will be coming out around that, and it's in particularly we're hoping to be looking at sterilisation in that session. So thank you